day, everyone. Welcome to the online symposium of Abra High School. I am Teacher Redo S. Barbosa and a guidance designate of Abra High School. I'll be sharing with you some intervention strategies to drug dependence and inputs on BKD or Barkada Contra Droga organization. These are the things that I'll be discussing with you, which includes preventive, curative, and rehabilitative approaches. You might have heard some of this from our previous resources speakers, but it is quite necessary to deepen our knowledge and understanding to the importance of intervention. The first intervention strategy is preventive measure. The most effective way to handle drug abuse and dependency is to prevent its onset. Prevention involves a multidisciplinary approach to keep people away from drug abuse or addiction. Prevention of drug abuse is not normally the duty of one group of professionals alone. Nurses, teachers, counselors, groups, and family leaders are expected to take active part. For effectiveness, each group needs to understand the selected abusive patterns. The caregivers should be aware of the economic factors associated with drug abuse and how to help the individual at risk to learn how to cope with anxiety and other stressful conditions without unnecessarily using drugs. Since most student drug abusers use drug as an aid for their studies, they should be counseled on good study habits with a view to minimizing the need to keep awake all through the night to study during examination periods. Where drugs are to be taken for curative reasons, it should be given only after appropriate examination and prescription by qualified medical practitioners to avoid the tendency of drug dependency. Health awareness and education programs need to be regularly provided and incorporated into the curricula of most educational institutions. The target groups should be educated on the psychological, social, and economic implications of dependency, producing drugs, and appropriate measures should be employed to keep people away from drugs of addiction. Secondly, curative measure. Curative phase requires early detection of clients involved in drug abuse. It encompasses the care given to drug addicts during hospitalization. The identification of drug abuse requires both sensitivity and inquisitiveness on the part of caregiver. Caregivers need to work closely with the client's families, and in doing so, goals of care must be attainable. The underlying factors that lead to drug abuse should be investigated and eliminated wherever possible. Supportive relationship with the drug abuser during the detoxification period usually affects his attitude favorably in the stages of rehabilitation. Reduction of the physical and psychological discomforts during the detoxification period is always accomplished through many comfort measures. Thirdly, rehabilitative measure. This involves the coordination of client care through appropriate referrals and careful monitoring. Emphasis here is on the reintegration of the individual into the community. The following programs are incorporated into the plan of care: counseling and psychotherapy, group activities, psychotherapeutic environment, interpersonal relationship. Let's proceed to counseling and psychotherapy. In this aspect, care is directed at helping the individual reach the source of his problems and to develop positive problem-solving techniques. The client is necessarily engaged in activities so that he or she will be diverted from the usual activity that he or she is doing. It may be necessary to refer client for special counseling sessions and other supportive services. For group activities, group interaction is highly encouraged. Satisfactory socialization is one of the ultimate aims in the treatment plan of addicted person. Active involvement and participation of the individual in the group will prevent isolation and loneliness and create sufficient self-confidence in the client. Psychotherapeutic environment. Presence of the drug within the vicinity of the client needs to be controlled. The atmosphere should be pleasant and conducive, but not too stimulating. Interpersonal relationship. Addicts need relationships that would assert their self-confidence and self-respect. This is necessary to satisfy their emotional needs, promote feelings of comfort, aid socialization, and prevent dependency. Thus, a caring interpersonal relationship must be established and maintained. To conclude, drug abuse is a serious social problem that health educators, nurses, teachers, counselors, psychologists, groups, and family leaders should participate in preventing through appropriate intervention strategies. Access of the public to drugs must be more strictly controlled. And to achieve this, the full cooperation of the physicians, pharmacists, and law enforcement agencies, including national drug law enforcement agencies, required. Such control should be targeted at the most vulnerable groups in the society. These include the following: adolescents or students who take some drugs because of the euphoric feelings obtained from their usage and other social reasons, such as going along with friends or keeping away. Children from broken homes and others from rich parents who are at risk, especially where there is lack of adequate parental care and attention. Businessmen, including traders who are too busy to obtain proper medical checkup and who therefore resort to self-medication or treatment from quacks, thereby abusing several drugs. Prostitutes who abuse antibiotics, which they use as prophylactic to prevent sexually transmitted diseases. Actors, actresses, and musicians who use drugs such as Indian hemp, cocaine, and heroin for their euphoric effect to enable them remain active. Sportsmen and women who abuse drugs to gain excess strength. Commercial drivers who abuse drugs to remain active. Health education and counseling goals should be mutually established with the various groups and implemented gradually with continuous support and reinforcement for positive steps taken to ensure the control of drug abuse. One of the positive reinforcements that we have been adopting to ensure the control of substance abuse in the school community is to adopt a project on BKD, wherein students of upper high school are encouraged to participate in all of the activities. In this connection, however, the disturbing high levels of illicit drug use remain a problem among adults, especially the students at present. As the physical, social, and psychological home away from home for most youth, schools naturally assume a primary role in substance abuse education, prevention, and early identification. With this, the Department of Education strengthened the awareness and preventive measures in the school by implementing Barkada Contra Droga. Barkada Contra Droga is a peer group organized to provide and support school activities that promote awareness and intervention to drug abuse and its related issues. This group also supports the projects of the community and its local government with the same objective. This organization is supported by the students, teachers, school administrators, barangay councils, local government units, private institutions, and other identified stakeholders. This school year, the upper high school is initiating activities to fully implement Barkada Contra Droga. This is to encourage upper high school students to be part of the BKD organization, where they will be helping their respective barangays on how to influence the youth who became drug dependents and drug users to stay away from drugs and to prevent the abuse of drug use. We will be updating activities in our FB page, Abra High School Libro ni Abreño, from time to time. The documents will be presented in order to evaluate the objectives that have been realized and to improve other concepts for the betterment of the organization and the Abra High School family. Thank you very much.